So I'll have to tell you, thank you first of all for inviting me. This is my favorite celiac organization in the United States. In Canada, we just have one. So when I first came to the United States, I realized there were about a dozen little groups, and I thought it should be like the IBD, the CCFA. If everyone got together who was interested in celiac disease, we could be much more powerful than all these small groups. So I think the CDF is emerging as the one that's going in the direction to be the one to lead all of our people, whether they're physicians, patients, and people who are interested in researching celiac disease as well. Although we've talked about pipeline drugs, a lot of them over time, I track them on trials.gov, and you can go and see these studies. Unfortunately, a lot of them have dribbled away. There's been no progress, no publications. So I think that really is an area that we have to look at this. So I think I'm going to have to be here so I can click. Just realized that. Okay. So Marilyn gave me this interesting talk. What does your doctor think? And I've been giving talks for the last 3 years about, and I'll go back to this. So these are my disclosures here. So when she gave me that topic, what does your doctor think? So what I'm going to give you a journey of looking at patients who have symptoms that could be celiac disease, could be non-celiac gluten sensitivity, could have IBS that have reactions from wheat. So I'm going to talk about that. So an update a little bit on celiac disease. What is non-celiac gluten or wheat sensitivity? And what about wheat allergy of a classical allergy like peanut allergy, when they have milk allergy and they get hives and problems like that? So talk as well about people who are eating gluten-free for a long time. Can we still diagnose them as having celiac disease? And the answer is yes. A lot of our doctors would say, oh, you've been eating gluten-free. We can't tell you whether you have celiac disease or not. And that's not really truly. So this is one of my patients. She came to see me. She was down at the San Diego Celiac Support Association, and she came up to me and she said, I think I might have celiac disease. And then she went on a gluten-free diet for 2 months, and she felt better, but then she started to have other kinds of problems. She was allergic to onions and peppers, although the symptoms were not of an allergy specifically. She was having bloating and loose stools. She wanted to know what she should eat and not eat. So what are my questions for this patient? So this is what I have in my mind when I see patients that, and I'm willing to give you a PDF through the CDF to be able to download my slides. So, because trying to make notes is you're going to go crazy because I'm going to talk. We'll be here all night. So what I put together a couple of years ago, here you can see. So the wheat allergy is one type, celiac disease, the non-celiac gluten sensitivity, and wheat starch intolerance. And I'm going to go over some of these. So here is the immediacy of the symptoms after you consume gluten or wheat. So the wheat allergy is a really immediate one. You can get hives, you can have asthma. These are typically in younger children. Wheat allergy is something that start to grow out of it somewhere around 13 or 14 years. However, there are some older adults who will have wheat allergy persisting. Celiac disease, as you know, can be very delayed, and then it makes it very difficult for the gastroenterologists and other physicians. They say, well, you don't always have problems with gluten, it seems like, but it's sometimes how much you've eaten and slipped up on it. So, and the varying dose is really between patients. Some people are very sensitive. For example, people with the skin version of celiac disease, dermatitis herpetiformis, that keeps them on track because they instantly, within a few hours, will get their itchy blisters over their elbows. However, people with celiac disease without that may not perceive that they've been exposed to gluten all the time. There are lots of celiac disease patients who have been eating gluten and they don't have a lot of symptoms. So then the non-celiac gluten sensitivity, this one has some features, and I'm going to talk about the fact that we can't diagnose this disease very well because we don't have any biomarkers, we don't have any blood tests for it. So these patients can be very exquisitely sensitive to gluten. They can smell it, it makes many symptoms for them. And the wheat starch intolerance is like a IBS kind of symptom that after they eat it, they'll start to have bloating and loose stools. All right, then the other thing, look at some of the features. So anemia, the only group of this people would be the celiac disease patients. The rest of the group are not typically going to have anemia. The neurological, however, pops up in everything but the wheat allergy. It can be in celiac disease, non-celiac gluten sensitivity, the wheat starch intolerance, maybe not as often. And then, do we have any tests for these things? Yes, we have the RAST, or the skin testing for people who have wheat allergy. We have testing, as we've heard, the TTG, IGA, and I'll touch on that some more, and the deaminated gliadin peptide antibodies. So here, we really don't have a marker here. There was some interest in looking IgG, IgA, but the studies don't bear that, and there's nothing here in that area. So again, here just to look at, see, food hypersensitivity, food allergy, children, celiac disease, it's the gluten. Eosinophilic GI disorders are a type of allergy, but it's not through IgE or mast cells, it's through another immune type of cell, the eosinophils. And in children and young adults who have, and I have lots of adults who have this disorder where wheat is a major factor causing heartburn, difficulty swallowing, and you need to get an endoscopy for that disorder. There is some overlap with celiac disease and the EOE, so if you have symptoms, your doctor should really think about when you're evaluating with the endoscopy. It's pretty normal now for us to be biopsying the duodenum and sometimes doing the eosinophil, looking at in the esophagus and the stomach, just in case there's an overlap of some other diseases. So these are the other things. This doctor, maybe not all the doctors you see, should be thinking all of these different symptoms that are part of celiac disease and other autoimmune things. So first and second degree relatives, if you think about them and you start thinking, great, Gertrude had celiac disease, you could have got that gene too. They may have autoimmune connective tissue disorders, SLE, lupus, rheumatoid arthritis, and many others. The autoimmune endocrine are significant. Autoimmune thyroid disease, like Hashimoto's, is a very, if someone had that, I would think about screening them for celiac disease. Same in our liver and bile duct. There's many autoimmune disorders and they overlap with celiac disease. And you can see here, there's other gastrointestinal ones like lymphocytic colitis or microscopic colitis. So your patient, as looking at this, the doctor should be thinking of all these things and thinking who should we screen for or diagnose celiac disease. So the picture of our disease has changed over. It's much more prevalent. when I first came from Canada to the United States, people didn't think there was celiac disease. They thought it was 1 in 5,000, whereas in Canada, we thought it was about 1 in 1,000 or 1 in 2,000. And interestingly, most of the doctors who are expert in celiac disease in the United States, 10 years, 20 years ago, all were trained outside of the United States. So the other thing is people are always looking, the physicians are thinking that the patient's going to be very skinny, looking like they'd been in a concentration camp, because that's what the picture we learned in World War II. The children in the Netherlands, when they were embargoed and they didn't have any wheat, these children did very well eating tulip bulbs and potatoes. And then when the embargo was lifted, when the Allies freed the Netherlands, all those children who did well in this wheat-free diet suddenly became ill again. And so, but we still have that. A lot of doctors think that someone's really skinny. However, there are studies to show, Carol Semred up at the University of Chicago, she sees a lot of people from the Middle West, and these patients are even super obese. I just was seeing a patient, she had a very high TTG, and she ended up having, her BMI was 50. A normal BMI is around from 20 to 24. So she was very, very, they had to put her to sleep and put a breathing tube to do her endoscopy, but she does have celiac disease. So when your doctor says, oh, you're too chubby, you don't have celiac disease, tell them that. Please screen me. The symptoms are there. And the other thing is, we know that men and women, when we look at the antibodies in the blood test, it's equal. But when we see who's getting diagnosed, it seems to be more women, and that may be because they are more aware of their health. And we know that for other diseases like IBS, more likely women will go to a doctor and get diagnosed. So now the second case here, this comes from Guy Weiss, and he is at UCLA. He trained with me, and he's an excellent gastroenterologist. He's from Israel. He's very interested in food intolerance. So this is his case, a 25-year-old, and this gentleman was healthy overall, but he was having foggy mind, and he had some bloating, and he was on gluten-free diet for 3 years. And so he had no other history of autoimmune or allergy. These are the questions we usually ask them. He did see a naturopath and purchased supplements and vitamins, and he also got some testing, which we'll show you here. So Dr. Weiss and I are presenting at the Digestive Diseases. The AGA has a course every year. So these are the things that our patients are coming in to see us. Okay, and another one like this. And I'll come back to that. So what are the best tests that we have for screening for celiac disease and diagnosing? So it is the tissue trans TTG. It's 90% sensitive and 98% specific. And this was developed and came on the market in Europe and North America and the world around 2001. And we use this as our workhorse, and it's very good for young people as well, just to see can they have celiac disease. And I have to say too that I have many residents, internal medicine residents, that rotate with me, and every Wednesday afternoon, I'll have maybe 3 or 4 patients with celiac disease. And so they're getting the training now of what we should be doing for our patients that come in. And a lot of them now, just if they see abdominal pain, they're going to order that TTG. So going on to the diagnosis, the celiac disease, these are for gastroenterologists. Sometimes the surgeons or doctors who are not up to date, they may not take the right biopsies. So that's the other thing. We train through courses and through our residents and our GI fellows to make sure they know that they shouldn't just take one biopsy. They should take 4 to 6 in specific parts. So now what do we do on my patients that are already on a gluten-free diet? Just like that young man who's got the neurological type of symptoms and the other lady who has diarrhea and bloating. So first of all, sometimes it takes 2 to 3 years for the biopsy to go back to normal, even though somebody's on a gluten-free diet, a strict one. So when you see this patient, is what I teach this to the lots of doctors, don't say you can't be tested at that time. Get the antibodies. If they have enough symptoms, diarrhea, iron deficiency, anemia, you have to do an endoscopy anyway, and you should go and make sure that they don't have any markers of celiac disease. And the other thing I often do, we'll do the HLA genetic test, which is it's not so expensive anymore. I have patients where I'll say, well, if we don't have any markers for having celiac disease susceptibility through the HLA DQ2 and 8, then you won't have celiac disease, but very often the patient does, and then we'll go ahead and suggest that most likely this could be celiac disease. And this is a test that you should only need once in a lifetime. And it's just a very small piece of the genome. Everybody is worried about genetic information, but this doesn't really, it's not like some other genetic testing that has some impact on your insurance, but this is not something that would, because it's fairly common, 40% of Americans will have the genes to be able to have celiac disease. Here's the thing I show to my doctors, and you folks can take this in. So the big pale blue is the whole genome of the United States. Then the blue, the dark blue is the center part. But the white circle are the 40% of Americans who have the genes that could have celiac disease. And within that, the only group that does get celiac disease has to be within the white, and it's 1% of the United States of the pale blue, and it's 2 to 3% of those that have the genes, the white circle. We knew for a long time that there was things related to that. So what about alternate tests for food allergy or food intolerance? So this is something, this is your doctor should tell you, but a lot of our doctors are using these non-scientific based testing. And so some patients are being misdiagnosed. The NIH, and is also in Europe, have bodies to put, and here it's at the bottom, it says, this panel says, recommends not using these tests for routine diagnosis of food allergy, which also includes celiac disease as far as the NIH considers. So everything with an asterisk here, and you often are paying out of pocket to get this test. You can see a lot of things have the asterisk, pretty well everything here. And some of them can be dangerous because they make them, there was a case in Ontario in Toronto before I left for Canada, to the United States. So 2 children, they were twins, and this gastroenterologist had switched over to being an allergist, and he did this electrodermal testing and applied kinesiology, and he told the mother that they weren't allergic to peanuts, and one of them had asthma and the other one had to go to the ICU. So these can be very dangerous because they're not really reflecting science and medicine. So, and here's some more of them here, and some of them are no longer. The blood tests that go for the IgG4 instead of IgE are overly sensitive, and in Europe and US say not to use it because children were being so restricted based on these blood tests, and they were losing weight. And so they say that it's dangerous and it's not good for adults either because they'll base the test. And this one up here, The LCAT is another one. It's not based on science at all. And I remember a patient came in, she said, "This isn't working for me." And I said, "Well, it's because there's no science behind this." And she said, "I paid $2,000 for it." And so that young man was in that situation. He paid money, and he was not a very wealthy guy. And sometimes the treatments that people suggest are very expensive too. And the other thing is, what happens when people tell our doctors, "I feel better off of gluten"? Does that mean they have celiac disease? But not necessarily. People with IBS, if they eat a lot of grains, they may be difficult to digest, and they'll have the bloating and diarrhea. And there's other things that before we went gluten-free, our patients may have had other things beside gluten that could be causing problems in bread and pizzas and things that may not be the gluten that's causing the problem. So a long time ago, a group put together, it's not that long ago, but 2009 feels like a long time ago, the overlap of IBS, irritable bowel syndrome, the spectrum of celiac disease, and here is the oops, I keep doing that. So what is the non-celiac gluten sensitivity? The definition is gluten or wheat sensitivity are terms that encompass individuals who report symptoms or alterations in health related to perceived gluten or wheat ingestion. And you have to exclude wheat allergy, and you've got to exclude celiac disease in that setting. So wheat starch is made up from fructose, which is a sugar, and fructans, and that is part of the FODMAP. How many of you are on the low FODMAP diet? Some, okay. How many of you are actually on a gluten-free diet? Okay, quite a few. So some people are now looking at the low FODMAP diet too, and I'll come to that just briefly. I'll go through it. Is the symptoms are very similar to IBS and other functional GI disorders. So here, over time, we still don't really have any biomarker for this disease or disorder. It's not really a disease and we don't even know the prevalence of disease. Some people will put on their website, for example, Entero Labs says that 30% of the Americans have this disorder, but how can you get a prevalence when you have no marker for this disease? We don't know exactly. There's been many testing and trials and research to try to understand it, and we've not come up with any blood test, no gene, nothing to say what this disorder is. So one of the testing that was popular in Europe was to have you would do a double-blind gluten placebo trial, and you would have pills that had gluten and also a placebo, and they would look at these. So they looked at them, they did what was called a meta-analysis and from Europe, and they had 10 trials. They were over 1,300 adults. The trouble is, you can see these different tests, trials were very, some of them went out to 6 weeks. One was just 1 day testing and all kinds of different levels of gluten challenge. So it doesn't really help us. So we don't have any way at this point in time to say who has non-celiac gluten sensitivity. So this was from Peter Gibson and Sue Shepard, who came up with the acronym called FODMAPs. And what they did is they gave patients that had IBS, qualified as IBS way back in 2011, and they challenged them with either a placebo, which is the blue, and the fuchsia color is the capsule that has gluten. Patients don't know which is the placebo and which is the gluten. And it shows the patients with IBS were eating gluten, and they were getting symptoms of abdominal pain and bloating. However, 3 years later, the same group published in Gastroenterology, what they did is they took the same kind of patients, a new cohort that had IBS, and they looked at them and they decided they would put them a 2-week of the low FODMAP. And you can see in this black here, at the beginning they have all different symptoms, but the end of 2 weeks, all of the patients have decreased their symptoms. And then when they get challenged in the placebo, which is green, and the blue or the purple are two different pills that are blinded again for the patients, you can see that only the placebo went up with all their different symptoms, pain and bloating. So it suggests that the FODMAPs and probably the wheat starch is causing problems that cause this non-celiac gluten sensitivity. So in here, the most recent study was published in Norway in gastroenterology. What they looked at in Oslo, they found a group of patients that they self-instituted themselves on a gluten-free diet, and they did not have celiac disease. And what happened is they randomized them to 3 different types of bars. One of them was something you could get in the stores regularly in Norway called muesli bars. Then there was bars that looked similar that had gluten, and one that looks like the muesli bar. And it was full of fructans, which is the sugar, not the wheat. And so guess what? What people have been thinking of this for a long time, that fructan is the thing that's causing problems for our patients with IBS. So they may be feeling better off wheat, but it's not the gluten, it's the starch. So I think we're going to understand more and more of this over time. So, and this is something that Joe Murray published a number of years ago, and here over time. So this was the first group for 2 years. It's over 5 years, from 2009 to 2014. And he calls these people PWAG, people without celiac disease who are avoiding gluten. And then the blue part of it is undiagnosed celiac disease, and green is the diagnosed celiac disease. And then the next one, you can see it's getting more PWAG people. But at the good side of it is we have more diagnosed celiac disease, and we now have undiagnosed celiac disease is getting lessened. And this comes through the NIH, the NHANES study. Every year they survey all kinds of dietary diseases in the United States, and celiac disease is one of them. So, and then in the last of the 5 years, you can see now 72% are now eating gluten-free without celiac disease, or at least they haven't been diagnosed, and the undiagnosed is down to 12%, but still that's not that great. Come to a lot of countries. In Scandinavia, they think they have 75% or more diagnosed in those countries, but here we're in the 10 to 15%, which is kind of terrible when you think about it. If I'm on a bus or an airplane, I'm always thinking, I wonder who's got celiac disease here that hasn't been diagnosed. So I could get them in my clinic. Okay. So the other thing is gluten-free was called last year, right before I became the president. I had to give a 10-minute talk to the big audience. So gluten-free diet is the most popular diet ever. However, this year, Medscape said the low FODMAP diet is the most popular. So this one here, is, I was visiting our son just before Thanksgiving a few years ago, and I thought, maybe I should go on the gluten-free diet here and get rid of that flab on my belly. So I do eat a lot of naturally gluten-free foods with my husband. My husband was a banana baby. So there are some downsides about eating gluten-free for those who don't have celiac disease, and then it's also it's a concern for people who eat gluten-free. So I tell people as much as they can, naturally gluten-free food. Don't have as much processed gluten-free. One year, my husband got a pecan pie and for Whole Foods, gluten-free, and it was 2,000 calories. He did eat it all. Those of you who have seen my husband, he's not exactly obese or anything, but you have to think about these things. And there's been some concern also about rice flour because it's low-lying and the insecticides are heavy metals. So there are some things in the other study that Ben Lebwell, it was published last year actually, and it was suggesting, it was a retrospective study, not a very good study at all, that people who've been eating a lot of gluten-free over time may have an increased risk of coronary artery disease. And my husband has just had a stent. But I think of all the time when I was dating him, his sandwiches were cheese, meat, and cheese. The bread was just pathetic in those days. And so I think that now we have much better products than we did. And so my advice to you folks, when I think of all these different things, because what am I thinking for you as a patient is to eat as healthily as you can and hope that we have better medications in the future and better diagnostics, all these things. So these, for the patients with celiac disease and the doctor is not thinking about celiac disease, the overlap with IBS and celiac disease is significant. The American College of Gastroenterology says IBS with diarrhea should be screened, and I think every patient with IBS should be screened for celiac disease as long as the patient wants to be screened. So diet-wise here, these are the diets that people go on for IBS. Some of them is gluten-free, and a lot of these diets are actually situations where you're decreasing the amount of gluten in some of them. So what about the FODMAP? And many of you know about these acronyms. Fructose and fructans are in wheat and lots of sugars in fruits and other things. So, and this is why the physiology of FODMAPs in patients can give symptoms, especially in IBS. And this is one study that's interesting. You can see here, there's two groups. There are normal people, controls, and there are IBS. When they're on this low FODMAP diet, not a lot of sugars and starches and foods that are with these problems. So you're measuring hydrogen breath, and you can see they're pretty well the same. However, when we go to the high FODMAP diet, the controls don't have that much, especially early on when they eat it. But the IBS patients, maybe it's their microbiome that's causing problems with the symptoms. So these are the patients that feel better by getting rid of wheat, but they don't have celiac disease. So this is one study that was published in the United States. There's lots of studies around the world now, in Australia, Europe, Canada, looking at the improvement if you go on a low FODMAP diet. And here you can see significant changes between pain and bloating in this study from the University of Michigan. So back to my patient. That first patient that she thought she had celiac disease, I always do this, I go back to the doctor and I see if she's already had an endoscopy, and sure enough she did, and she was not on a gluten-free diet, and she had a completely normal biopsy. So then I referred her to a very useful and helpful RDN, and she was very good herself. She has non-celiac and gluten sensitivity together. So she put this patient, and this patient came back to me at the end of the year. She had 6 visits with a registered dietitian. She paid out of pocket, but she felt this was really worthwhile, and she can modulate her diet now after that year working with a dietitian. Now, what about the other second food intolerant patient here? So he spent a lot of money on those food allergy testing, the ones that the NIH do not recommend for using, and we reassured him that his history was not consistent with food allergy and celiac disease was still possible. and he had been on a gluten-free diet for a couple of years, and so I tested him with the HLA testing, and he didn't have any, so I said, you can't have celiac disease, but you can still stay on the gluten-free diet, because I think he's one of those gluten sensitive and not wheat starch sensitive. And we don't have information about these patients because these seem to have more psychological and neurological symptoms. And this is an area where I don't have an answer that's very good with these patients. So just the take-home messages for you here. Symptoms of celiac disease. This is really not just for you, but for your family, your doctors, your health providers. There's an overlap of all these patients. We can't always know how to differentiate them unless they get actual evaluation. So the non-celiac wheat sensitivity or gluten sensitivity may have problems with the dietary wheat search, and the low FODMAP diet is very helpful in that setting. Now, just another thing, a lot of our patients and a lot of doctors, I give more lectures to doctors, they always want to hear this here. The leaky gut is not a disorder. We all have a leaky gut to actually survive. That's how we get our things in, and Candida is part of our microbiome. A lot of patients and doctors are thinking that this is a diagnosis and we're probably missing something. We should be looking for celiac disease and not talk about a leaky gut and look for something that we can treat. And lots of things here, a lot of foods that cause problems who have wheat sensitivity. Remember that 1%, this is again for doctors, 1% of the population has celiac disease, 2 to 4% of adults have food allergy, and 15% of the US population has IBS. So many of these things are overlapping. So these are the things that your doctor is thinking about. What kind of gluten sensitivity do you have? Do you have celiac disease or not? And the other thing I want to make sure people get the right doctors, get the right tests, and not be paying out of your pocket, because Medicare will probably stop reimbursing all these things that the NIH says is not scientifically based. So I've probably gone overlay, but I'm happy to entertain questions, and of course I'll make a PDF, like a handout that you folks can download. So thank you very much. Thank you.